All right. Good afternoon, good morning, depending on where you're calling in from. Welcome to It's Worth a Shot. Today, we're going to be talking about the upcoming respiratory season and the vaccine recommendations. So we're happy that you guys could join us today. Let's go ahead and go to the next slide. So just a quick disclaimer, this presentation may contain information and/or content supplied by third parties. Today, that is not the case. We have Mountain Pacific's very own Kyla Newland presenting for us, so we're happy to have her join us. Let's go ahead and go to the next slide. We have a couple of updates and reminders. As a reminder, it is National Immunization Awareness Month. There are some different resources that you guys can use to share National Immunization Awareness Month. So we've got the links in the slides for you guys. And then the bottom link here is a presentation that was actually done yesterday. It was August 6th, and the CDC presented on some updates for the respiratory season as well. This link will take you to the recording for that. So great information. Kyla is going to present on some great information. I highly recommend all of you guys take a look. Let's go ahead and go to the next slide. We have one more training reminder for you guys. There is a fostering a culture of immunization in your practice. Again, this is another training that came out in partnership with the CDC, and we'll have the link to the training. So this is for anybody that's wanting to improve the conversations that they're having with their patients, their residents, even community partners. So make sure you guys take a look at that, and it helps kind of guide that conversation within your practices. So, all right, let's move on to the next slide. I have a couple housekeeping items. So as always, your feedback is welcome. We want you guys to share any upcoming topics or ideas that you guys would like to see presented. So we'll put a link in the chat for an evaluation. You guys can put it into the chat or you can drop it into the evaluation. Either way, we take a look at those comments, and then that helps guide our upcoming session. So we appreciate your feedback. Speaking of feedback, we have a couple of polling questions for you. So let's go ahead and launch the first one. Does your facility keep Narcan in the emergency kits? I'll give you guys just a second to answer. All right. So I have some results coming in. Okay, it looks like it's stopped. All right, so we'll go ahead and end that poll. It looks like 85% of you guys. For those of you guys who selected no, if you want to put in the chat maybe why you don't have Narcan in your emergency kit, if it's an ordering and access thing, please let us know. And then let's go ahead and launch the second polling question. Okay, so the next question is, does your facility have an opioid stewardship program? And then if no, are you interested in starting one? Yes, no. We'll give it another second. Trying to get that at least 50% response rate there. Couple more. Okay. All right. It looks like the results have kind of stopped. So it's kind of a mixed bag on that. So for those of you guys that selected no, it looks like there's definitely some interest there. So feel free. Like I said, you can put your name in the chat if you would like us to contact you, or we can take a look at the results and reach out and provide assistance. So we appreciate your feedback. All right, let's go ahead and move on to the next slide. We'll get right into our fall vaccine updates. And again, I would like to welcome Kyla Newland. She is one of our account managers here for Mountain Pacific, coming to us from Alaska. So welcome, Kyla.
Thank you, Callie, and welcome everybody to our call today. I have some timely information to deliver as we move into our fall respiratory season. We can go to the next slide. So there was an ACIP meeting last month, mid-July, I believe, and they did change some of the recommendations. So the first one I'm going to talk about is the RSV recommendation. And as many of you folks will probably already know, we had 2 RSV vaccines approved probably maybe a year and a half ago, maybe longer than that. And the ACIP came out with their initial recommendations were to give everybody 60 and older an RSV vaccine. And so when they met again in July, they decided they were going to adjust their recommendation and make it a blanket recommendation for patients 75 and older to receive the RSV vaccine. But they were going to put this caveat in there in this patient population 60 to 74 to only vaccinate those that were at highest risk for RSV. So if we go into the next slide, we will see the indications for patients that are considered higher risk for RSV. So kind of the things you would expect. Obviously, we definitely got residents of nursing homes in here and long-term care facilities, people with any chronic diseases, chronic pulmonary diseases like COPD or asthma, cardiovascular diseases, heart disease, coronary artery disease, those that are immunocompromised, anybody with blood disorders, neurologic disorders, endocrine disorders, so that would include folks with diabetes, kidney and liver disorders, and then any other underlying factors that a provider thinks put a patient at higher risk of getting respiratory disease, specifically RSV, can get that vaccine from age 60 to 74. So they did this to be judicious about making sure that there was a cost benefit to giving the vaccine, and also the risks are still kind of being evaluated as far as side effects, since these are some newer vaccines. Ooh, the cost of the RSV vaccine. I want to say it's around $300. Don't quote me on that. And I am not sure about Medicaid covering it. I would think it would be covered under Medicaid. In Alaska, I know they are covering it under the adult vaccination program, and it is covered under Medicare under Part D. So I think it might be dependent on your state Medicaid program, but I think by this point they probably do have that included. And the other thing I will note about RSV is there's a third vaccine that just got approved in the last couple months. It's an mRNA vaccine similar to the COVID-19 vaccines as far as the way it works. I don't think is out in the market yet, and it sounds like it will be even more expensive. So I know in the state of Alaska, they're not going to be stocking that out at our state program at this time, but I would anticipate more information on that. And then as far as the dosing for the RSV vaccines, it is a one-time vaccine. So if folks have already received that and now this new recommendation comes out, as of now, if you've gotten one dose, you're done. We can go to the next slide. So next, influenza or flu. We know our flu season usually ramps up in the fall season as well. So basically, the recommendations haven't really changed at all. Basically, everybody 6 months and older that doesn't have contraindications. There are very few contraindications to get a flu vaccine. So pretty much everybody 6 months and older should get a flu vaccine. The vaccines available this year are trivalent, which is a change from last year. We had 4 strains in the last several years, actually. We've had 4 strains, and what they saw is the second influenza B that was included was not circulating widely anymore. And so they made this decision to remove it. So they will all be trivalent this year. We can go to the next slide. And this is just a nice chart. This came out from the immunize.org. This has all the available products that will be on the market this year. There are two vaccines that are preferentially recommended for patients 65 and older, and that would be our Fluad and our Fluzone high dose. So those two products on the chart, preferred for 65 and older, and actually only approved for 65 and older. So if you do get those products, those are covered under Medicare as well. And so they found basically that those two products give a better immune response in that older population. We can go to the next slide. It looks like Callie put in some information about getting vaccines covered. Thank you for that. And then COVID-19. So basically there's going to be a new formula that's coming out. Hopefully this month. We don't have a date yet, but the CDC says that they're going to recommend whatever the current vaccine is that's going to come out, and everyone 6 months and older should get this as well. So fitting right in line with our flu vaccine, we can give these vaccines at the same time. Hopefully we'll have this one available so we can give them at the same time. And everybody should get that updated dose this fall. We can go to the next slide. So for pneumonia, basically the only change is there was a new product that came out on the market. If you remember, previously there was a PCV20 that was preferentially basically recommended for most folks of adult age. And so we have this new product, PCV21, that covers a different kind of group of strains. It's not like it's one additional strain. It's a different mix, I guess, of pneumonia strains. And as I understand it, I just found out today, Alaska at least did some research, and what they found out is that the strains that PCV21 covers, that PCV20 didn't, are not actually prevalent in our state, and so they're going to stick with the PCV20. But just knowing that this other vaccine is an option, and maybe based on geographic factors of what's circulating in your community. I don't know if other states are looking at that similarly, but I found that kind of interesting. But it is another option. And we can go to the next slide. I have a question in the chat. It looks like combo vaccines. Yes. So we have heard that there is going to be a combo COVID and flu, or there is one. I know for sure there is one in development. It has been in development for a while, but it didn't get approved, or it wasn't far along enough in the approval process to be recommended this year. So hopefully we will get that for next year, because that would be really nice just to be able to get one shot. So I did want to touch a little bit on the H5N1, which is also known as the bird flu. So it has been circulating for a long time. So since 1997 in 24 different countries. And it presents similarly to our normal influenza. So with the respiratory, lower respiratory tract symptoms, and it also can be found in the eyes with redness and kind of like in eye infection type symptoms. And so in all the cases that we've seen, which is 919 human cases, it does have a 51% fatality proportion, which is pretty high. But if we look at what's circulating now, we can go to the next slide. You may have heard that there was cases in Texas, Michigan, and Colorado recently, 9 total human cases. All of these cases were clinically mild. Nobody was hospitalized. So that's good news. And we are seeing that in poultry exposures, people that are visiting a poultry market, or if they have direct or close contact with sick or dead poultry, exposure to dairy cows as well. That's what they saw in Colorado. but we have not seen any human to human transmission so far, so that's good news. And the other good news is that there is a vaccine that we can use if we see cases ramp up. There would be potential to do a vaccine in the people that would be at highest risk. So those people that might be working with dairy cattle, for example. And the other thing I'll point out is this is totally different than the regular seasonal flu vaccine that we're vaccinating against. So we're not currently vaccinating against bird flu, but we do have some available if it gets to the level that we would vaccinate those that were at highest risk. So we can go to the next slide. So I'll just touch briefly on our medications for COVID-19. I see I didn't even put COVID-19 on here, but these are the medicines to treat COVID-19. And you might be seeing these more frequently as we are seeing some outbreaks in different regions. Our standard drug that we want to use is Paxlovid. It is a really effective medicine. It cuts hospitalization by more than 60% and death by 75%. It is currently recommended for those that are at highest risk of getting severe COVID. So that's going to be our 65 and older patients or anybody else that has additional risk factors that put them at higher risk. So we think about those things that we looked at, similar to RSV, all those kind of chronic conditions should be considered for therapy. It's approved for 12 years and older. And there is kidney dosing available, but there's no requirement for us to do kidney testing like right when we're going to prescribe it. So if someone has had their lab values in the last year and we know that their kidney function is fine, we don't actually have to do that testing in order to give the patient this medication. And then if we don't have labs and we're concerned, we can ask the patient if they have a history of any kidney function issues and do labs if appropriate, but it is not required. And then it does have quite a few drug interactions. In many cases, you can just stop a medication if it's a medication like a cholesterol medication, which quite a few of those do interact with it. And I will show you, actually, I'll show you right now a really good resource for looking at drug interactions. See if I can have that up. There it is. So this is a pretty comprehensive document. It's 7 pages, but it's got everything you need to know if you're looking at a patient and seeing if you need to adjust their therapy. So these medications are kind of like in the screen chart, or like the most common medications that are coming through on a drug interaction checker, which there's a link for that too. And I will put this in chat also for everyone. So if you go down here, basically there's 5 management strategies. So you can either increase monitoring for adverse effects, and this is going to be based on which drug it is, and there's another chart that tells you that. You can adjust the dose. You can temporarily withhold. So as I mentioned, you might want to do that with cholesterol medicine. And they recommend withholding it when you start therapy and for 2 to 3 days after you're done with your Paxlovid therapy. You can use an alternative, or if it is a contraindicated combination, you can use one of those alternative therapeutics. So the chart, let's see. The chart down here basically has lists of drugs that you should prescribe an alternative, temporarily withhold, adjust, and monitor for adverse effects. So I think it's a really good resource. There's a lot of links in here. There's a link to that online interaction checker. That's the Liverpool COVID-19 drug interaction checker. So I will put this in chat.
Kyla, I just dropped it in there for you.
Did you put it in there? Okay. Thank you so much, Kelly. Okay, so we can go back to our presentation. And the other thing I will mention about Paxlovid is it's important to start it as soon as you can. It's most effective early on. So it has to be within 5 days, basically. So 5 days of when your symptoms start, not 5 days from when you test positive. So that's kind of a distinction that I know has come up as a question a couple times. And we can actually go back to the last slide because I was going to just talk about the other therapies really quick. Basically, we know that Paxlovid is kind of our gold standard. It works really well. And most people can use it, even if they have some of the drug interactions going on, just with that adjusting therapy. But we also have remdesivir. It is approved for those 28 days and older. It does require liver function and prothrombin testing, and it is IV. So those are a couple of things that make it not quite as convenient for patients, but it is definitely an option for patients that can't take the Paxlovid. And then molnupiravir is kind of our third line. It's not nearly as effective as Paxlovid, and so that's why it's kind of at the bottom of the list. The other thing I will say about therapeutics, which will go back to the bird flu, is that we do have therapeutics to treat bird flu as well, and that's going to be our same therapeutic that we use for the flu. So that's Tamiflu, as folks know it by, or oseltamivir. So that's good too, that we do have therapy already available. And then there was one additional, can I share my screen again, Barry? Thing that came across my desk today, actually, that I wanted to share with folks. So the state, and this is specific for the state of Alaska, and I don't know if folks are seeing this in the other states, but we are seeing a huge surge in pertussis. And so this public health alert just went out this week for the state of Alaska, because we've already had, you can see on the chart here, so many more cases than previous years. And so there's a big push to make sure that we're getting our Tdap vaccines up to date. And that's going to be the tetanus, diphtheria, and pertussis vaccine that you need to get every 10 years. So I don't know if this is happening in other states. I didn't have a chance to research that because I just found out, I just saw this today, actually. And this just went out a couple days ago. So just kind of have that on your radar, that there might be a push to make sure everybody's up to date with their Tdap shots. Okay, we've got 2 cases in Fairbanks. Yeah, we were talking about why it's spiking, and we had a couple people that were a lot smarter than me on the call, and nobody really could pinpoint what's happening and why we might be seeing that spike, other than maybe pediatric vaccine rates have decreased, and we know that. So just wanted to make sure everybody was aware of that. And it looks like, Callie, you're putting some of the vaccine resources that are on my resources slide. So we can go back to the presentation, Mary.
Just so they don't have to wait for the slides.
Yeah, so there was a nice guide that came out from PharMerica this week, and it's basically like a seasonal respiratory vaccine guide. So we'll share that. That's on the next slide. And then what else was on that resource slide? Can we go to the last slide, Mary? Thank you. Oh, just our they did update the standing orders for the flu and pneumonia vaccines on the immunize.org website. Those are really good resources. And then I think this last link is the same one that Callie shared earlier, which was the CDC call that happened yesterday. I did listen to that. There was a lot of good information on that too, so check that out. I don't think there's any more questions. Feel free to come off mute or throw a question in the chat. And if you do need help accessing vaccine, if you're having problems ordering it, or there's cost barriers, Mountain Pacific is partnering with multiple pharmacy partners across our region to try to get vaccines out to areas that might be needing it. So please do reach out to us if you are in that situation, and we can help facilitate getting some vaccines for your patients.
Kyla, did you see the question about the cost of the RSV vaccine and coverage? I dropped a link in there regarding vaccine coverage and costs, but I didn't know if you wanted to speak any more to that.
Yeah, so I think I did say a brief estimate earlier. I think it's around $300. And Medicare Part D covers it. Medicaid, I'm not 100% sure that they cover it, but I know that they do pay for it in the state of Alaska. And it is expensive. And so that is kind of a barrier that we've heard. And another barrier is that since it's covered under the Part D component, and many people may be more familiar with billing to the Part B, that is something that we've heard from a lot of people. And there is actually, and I don't have this at my fingertips, I don't know if you do, Callie, but there's a billing guide that came out, was from CMS, I believe, right?
I'm not I want to say that I'm not sure who put that billing guide out, but we can send it out.
Yeah,
when we
that
send
was
the
something that
slides.
we've shared in the past, but we could share out again maybe with the slides too.
Yeah, and then as far as
So I see another
sorry.
question about the monoclonal antibody for RSV. The last I heard, it was coming to Alaska soon, because it sounded like there was a shortage on it when it first got approved, if I understand correctly. So I don't know an exact timeline on that, but that is recommended for infants to protect them in the first, I think, 8 months of their life is the recommendation. So from 0 to 8 months.
Hey, Kyla, I just wanted to let you know that I pulled up the guide for payment of prescriptions that Callie put in. And it says for Medicare Part B, COVID, hepatitis B, influenza, and pneumococcal are covered. And then under Medicare, that's Part B. And then under Medicare Part D, RSV and the shingles vaccine is covered.
Yep.
And then as for Medicaid, it says beginning October 1st, 2023, most adults with coverage from Medicaid and CHIP will be guaranteed coverage of all vaccines recommended by the Advisory Committee on Immunization Practices at no cost to them.
Okay, that's great.
Kyla, I dropped the billing guide in the chat too. I would anticipate that this will be updated because it still refers to the 2023, 2024. So this was the prior one.
Yeah, they'll update it with the new formula, but there isn't any changes in like what part of the coverage, B versus D. But I will mention that the Bridge Access Program is ending this month. And my understanding is when the new vaccine is out, that program is done because it was for the old vaccine. Okay, well, thank you everybody for your attention today. And hopefully you got some good information to help protect your patients this fall. Have a good rest of your week.
We just want to let you know that next week we'll be covering narcotic inventory management in nursing homes, and Jessie Kenzie, who used to work with Mountain Pacific and has moved on, will actually be presenting. She's with Farm America now. So again, next week on August 14th, it'll be narcotic inventory management in nursing homes.
Thank you.
Thanks, Miranda. Bye, everybody.